Hey guys, thanks for coming back and visiting me in my YouTube video. So today we're going to be talking about pharmacology. So your drugs, the drugs you can give your people or your patients. These are our discussion points. So we're going to be going over the drugs themselves. What are they? Which ones are we talking about? Indications, contraindications, the routes, and then the dosages over here. Now, before we get into this, I just want to make sure that you guys know what indication means and what contraindications mean. Because if we keep on going on before we actually get these down, there's no point. You guys aren't going to get it. So I just wrote down what indication means and what contraindication means. So indications, can you see that? Indication is the reason why you give the drug. That's what that says. It just looks backwards on my screen, so it's kind of weird. But, so indication is the reason why you would give the drug. So what's going on with the patient that makes me want to or need to give the drug? So that's what indication means. All right. Now, contraindication. What contraindication means, that is this right here. So I just wrote it down. My definition of what it means. It's not the textbook definition. It is the textbook definition, but in my own words. So, contraindication. That is, let's say I have a drug. The patient needs that drug because it's prescribed to them for their current condition that they're going through right now. But for some reason, something else is also going on that prevents me from giving that drug to my patient. Because if I give it to the patient, it could be life-threatening. It could have an effect that I don't want on my patient. So that's what a contraindication. So let's go ahead and just rewind real quick. Put this down. Indication means that is the reason for me to give the drug. It's a reason for me to give the drug. So something is happening for me to give a drug. That's an indication. Contraindication is usually under normal circumstances, I would give this drug. This is the drug. I would give this drug, but something else is happening that's preventing me from giving that drug. All right, so all that being said, let's go ahead and go into our little lecture for today. First drug. Now keep in mind, I'm not gonna go over every single little thing. We don't have time for that, not in these YouTube videos. But I'm gonna give you the foundation, the core of what you need to know to build upon, okay? First thing is nitro. So, let's see. Nitroglycerin. An indication for nitroglycerin. First off, they have to be prescribed the drug, right? So it has to be prescribed. So I'll put a little prescribed there. Secondly, they have to have chest pain, right? So for me to give nitroglycerin, the patient has to be having chest pain. That's another indication to give nitroglycerin. So chest pain. This marker's not coming out good. Chest pain, that's another one. So these two are pretty much the only things that I need for the patient. And obviously, if they're prescribed nitroglycerin and they have a history of cardiac related issues. So cardiac issues, I'll put that down right here. Cardiac issues. Cool, so these are indications for nitroglycerin. One, they're prescribed it, because you can't give nitroglycerin unless it's prescribed to the patient. The other one, they have to be having chest pain. We call that angina. I'll go over that in a different video. And then also they have to have a history of cardiac related issues, and that's why they have nitroglycerin prescribed to them in the first place, right? All right, so now some contraindications for which you would not give nitroglycerin. There's 3 that I know of. If you know more, go ahead and leave them down below in the comment section. So one of them is that if your patient has a low systolic blood pressure, you're not gonna give nitroglycerin. So what is that? So let's get some numbers out there, right? So it depends on your county and protocols, but we have a range. Now the range is if the blood pressure systolic is between 90 to 100, we're not gonna give this nitroglycerin. The reason for that is that nitroglycerin is a vasodilator. So pretend that this right here is a vessel, it's a vein, if I give nitroglycerin, it's gonna dilate. It's gonna increase the circumference of that vessel, and my blood pressure is gonna drop even lower. And that's very dangerous for your patient. Hyperperfusion, patient goes into shock. It's not a good thing. Cancel Christmas, it's not gonna happen this year pretty much. All right, so that's what goes on with that. That's why I'm not giving nitroglycerin if my patient has a systolic blood pressure below, or I mean between 90 or 100 and below. All right. Another one. So another contraindication would have to be if my patient has already taken 3 doses of nitroglycerin within, I believe it's 24 to 72 hours, but reference your textbook for that. But it's about 24 hours. So ask your patient 3 doses. So 3 doses within the last 24 hours. Again, double check me on your textbook. The reason for that is that if they've already taken 3 doses, those vessels are going to be dilating, and then you don't want to give more on top of that, and then really dilate the vessels and bring their blood pressure down. So it all really comes back to the blood pressure. We want to keep that blood pressure up. All right. The second one is, has your patient taken any erectile dysfunction medication? So that includes Viagra, that includes Cialis for men and women, and some other stuff out there. So ED medication, I put ED for erectile dysfunction, because erectile dysfunction medication, what it does, it opens up the vessels in certain areas, you know what I'm saying? So it's a vasodilator, so that's what I'm trying to say here. So if your patient has taken an erectile dysfunction medication in the past, again, reference your book, between 24 hours to like I think 36 hours, between that time frame, and then you're gonna add another vasodilator, being that nitroglycerin, that's not good for business. Your patient might die. That blood pressure is gonna plummet. So that's why you don't give any nitroglycerin if you have any of these things, any of these 3 things here, okay, going on with your patient. Now the route. For EMTs, nitroglycerin is always going to be given sublingually. So what does sublingually mean? That means underneath the tongue, sublingually, sub on the bottom, lingually, the lingua. If you know a little bit of Latin, maybe Spanish, Italian, whatever, it makes this easier. It makes medicine a lot easier. All right, so sublingually. So I'm just going to make it easy, under the tongue. Under tongue. That might not be spelled right, but it's okay. It's not an English class. So, all right. So under the tongue, sublingually. Now the dosage for this is going to be 0.4 milligrams. Now, as far as like how you give it, like how it's made, the medication, I guess I would say. I can't find a word, but it's either going to be a spray, so you're going to spray under the tongue, tell the patient lift your tongue up, spray under the tongue, or it's a tablet that dissolves under the tongue. So that's usually what you'll see with your patients. And then so we said, so you can give the drug up to 3 times, right, without calling medical control. Usually that's how protocols go in California at least. So nitroglycerin takes about 5 minutes to actually function, to actually work. So if your patient still has pain, progressive pain, within 5 minutes, you're good to go to give another dose, a second, and then a third. And then as far as the 4th dose, contraindication doesn't really mean you can't give it, like it's a solid, like black and white, you can't give it. What that means is that you might want to call med control. So the hospital you're going to, it depends if you're out in a rural area where it's far away, that's when this comes into play. So you might want to call and say, hey, I give my patient 3 doses, or they've had 3 doses, but their blood pressure is like 140 and they still have chest pain. Can I give it? So you see, so you still can give it, you just have to get direction from medical control or medical direction. And then it falls on them really, as long as you know what you're doing. Alright, so that's pretty much it with nitroglycerin. Let's go on to the next one. What am I going to talk about next? Alright, so let's go ahead and talk about glucose. So, glucose. So indication, so you would give this to a diabetic patient. they're mentally altered, they have a low glucose level count, right? So their glucose is low. Or let's say that your patient has a history of being diabetic. In some counties, EMTs cannot take glucose levels. They can't poke the patient. But if your patient has a history of diabetes, you get to the car, they're mentally altered because you just seen a bracelet, whatever the case may be. Maybe you've been there before, I don't know. But you can give, that's an indication. If they have a history of diabetes and their mentation is not all there, so they're mentally altered, these two are indications to give glucose. Now, as far as the contraindications, there's really not much there. The only real contraindication, this is oral glucose, by the way. You can only give it orally, so oral glucose, is if they're unconscious. So if they were mentally altered and you know they're diabetic and they just went unconscious, you can't give oral glucose because it can asphyxiate your patient. What that means is that it's going to go down the trachea and they can't breathe anymore and they die. So if they are unconscious, so I'll put an NC, unconscious, that means they're passed out, they can't swallow or can't swallow. So when this comes into play is that if they're so mentally altered, just so out of it that they just can't swallow, they can't follow commands, you can't give it. As far as the route, it kind of goes in with the word, it's orally, so they're gonna, it's just like a paste, you give it to them and they swallow it. It comes in a little tube, you guys will see it in EMT school. Or if not, then you'll see it in your textbook, you'll see it when you get out in the field. You actually do carry oral glucose, you do not carry nitroglycerin. Nitroglycerin has to be prescribed to your patient, okay? And then the dose, usually is about 15 milligrams, it's 15 grams. Let me double check myself. Nope, yeah, 15 milligrams, that's what I got here. Again, reference your book, all right? So let's put it here, 15 milligrams. And usually your paste, your tube will be about 15 grams or 15 milligrams. Yeah, double check me on that one. All right, let's see what else I have room for here. How about we go over epinephrine? Let's go over epinephrine. So epi. If your patient is prescribed again, so the indication, they have to be prescribed epinephrine. So prescription. That's not, yeah, okay, prescription. Just prescribed it. Also, if they're having difficulty breathing, hives, a clear indication that they're having severe allergic reaction, aka maybe also known as anaphylactic shock. It depends on which book you read again. So if your patient is going through anaphylactic shock, severe allergic reaction, it's okay to give it to. So they have to be going through, let's put anaphylaxis. So anaphylaxis. I'm not sure if you covered that yet in your class. So anaphylaxis. So how do you know if your patient is plummeting? Pretty much with anaphylaxis, what happens is that you will see the blood pressure going down, respirations are increasing, and your pulse will also be increasing, and you have wheezing. So these are all signs of anaphylactic shock. What happens with anaphylactic shock is that your vessels dilate. That's from the histamine being released, right? So your vessels dilate, bring that blood pressure down. Your bronchioles constrict. And that's what they start to spasm, really. They start spasming, and that's what creates that wheezing and that increase in respirations because you're trying to make up for the loss of O2. At the same time, your heart rate is gonna jack up because you're trying to make up for that blood, the volume, not volume loss, but the container of the vessels got bigger. Therefore, your blood pressure went down. So that's why you'll have those things. So you'll have an increase in respirations, increase in pulse. You'll have wheezing, and you'll have a drop in blood pressure. So all those four things you will see with the anaphylaxis. All right, So contraindications, honestly, there's not a contraindication. If they're prescribed an epinephrine, then they are physically able to take the epinephrine. The only contraindication would be like CHF, a crappy heart, pretty much. But yeah, that's it. So really, if they have an epinephrine, they can take it. And then the route, usually it's gonna be on the thigh. You just kind of slap it on the side of the thigh and then follow instructions, take the caps off, all that stuff. And you just hold it there for about 10 seconds. So it's gonna be mid-lateral thigh. I put that right here, mid-lateral thigh. And the dosages, so the dosages are gonna be 0.3 milligrams for adults. That's for adults. For pediatrics, for children, it's gonna be 0.15 milligrams. So now you're thinking, why is it more for pediatrics? It's not. Really, this right here is supposed to be 30, but we just say 3 just to kind of simplify it, even though it kind of makes it harder for some people. So when you see 0.3 milligrams, really it's 30, 0.15 milligrams. So that's what that means, all right? Let's see, what else can we talk about? So I only have room for one more drug. So that's all I'm gonna talk about is one more drug. So let's go ahead and talk about activated charcoal. So activated charcoal, use a different pen for this one. Man, I'm all sweaty, it's hot in here. Hair's all jacked up too. It's okay. See, the good thing about doing these free videos for you guys is that I don't really have to care about how I look. So, not a big deal with it. So activated charcoal. So usually you give these this drug to people that are going through an overdose, stuff like that. Primarily medications, like an overdose of medication, some kind of drug, they ingested something. That's when you give it. So an indication, overdose. Contraindication, it's that if it's an overdose, or when you would not give it, if it's an overdose, but they swallowed an acidic, so something that's gonna burn the way down. Because if you give activated charcoal, there is a good chance that they might throw up, and then it's gonna burn on the way back up. So you're actually causing more damage. So an acidic, the acid. Another reason why you would not give activated charcoal is because if it's been longer than an hour. Again, go back to your book and reference. These things change a lot as we progress. So if you're watching this video, especially like 3 years from when I made it, that might have changed. So if it's been longer than 1 hour, because it's already been digested, it's too late. There's no reason to give it. So greater than 1 hour, I'll put hour with the arrow going up, greater. The route, it's gonna be orally. They're gonna swallow this stuff, just like oral glucose, except it's much more disgusting. So orally. Now, the dosage. The dosage is 1 gram per kilogram. 1 gram per kilogram. So 1 gram per kilogram. Now, a lot of you people are gonna be like, whoa, John, slow your roll, take it easy. What the hell is that? Let me show you real quick. So, a kilogram is roughly about 2.2 pounds. So, let's see, 1 kilogram equals 2.2 pounds. See that? So 1 kilogram equals 2.2 pounds. So how are you going to calculate this? The way you calculate this is that you get their weight. So let's say I don't know, I'm horrible at math, so I'm going to say they're 150. That's how much your patient weighs. They weigh 150, all right? Now what you do is you get that number and you divide it by 2.2, and then you get your kilograms. So see that? Divide your weight by 2.2 because there's 2.2 pounds in each kilogram, and then you get your kilograms, and then you match that up to each gram. And that's how you do it. Hopefully that simplifies it for you. If not, ask your instructor or leave me a comment below and I'll answer you. Not a big deal. All right, so here we are. Nitroglycerin, glucose, epinephrine, and activated charcoal. Now there is one more thing I do want to go over before you guys leave me today. Is I'm going to just kind of go over how each drug works in the body, because the more you know, the better off you are. That's just the way it works. So let me find a rag. All right, so nitroglycerin, this right here is your heart. That is your heart. Well, over your heart, you have vessels, right? Here's your aorta that's coming off from your heart to feed the rest of your body. Well, off of that aorta, you actually have vessels that branch out and feed the heart itself. What? Because the heart needs oxygen too, right? It's like the rest of your body. Your heart needs oxygen to keep pumping, to keep you alive. Well, if for some reason you have an embolism. So what is an embolism? Real quick. An embolism is anything that shouldn't be there. It's a foreign object. Okay, that's an embolism, equals anything that shouldn't be there that is obstructing a vessel or the passage within a vessel. So let's say you have an embolism right here, right? So that could be a piece of air. It could be a piece of plaque, a piece of garbage, a piece of anything, doesn't matter, right? Let's say a little chunk of the inner vessel somewhere else in the body just kind of sliced off and kept on going down through the passage. And then it gets stuck right here in the vessel. Well, that's where angina comes from, or it could come from that. That's one of the reasons why you get angina. That's pain in the chest due to a lack of oxygen in the heart. That's really what angina is. So what happens is that now this is restricting blood flow. So blood's not really going to where it needs to go, to this part of the heart right here, right? So it's gonna start to die. Ischemia sets in, eventually the tissue starts to die, myocardial infarction, that's what that really is. So what we want to do is we can't reduce the size of the object that's in there, the embolism. That's the size that it is. It's going to get bigger if anything, right? Because the platelets, we'll talk about that later. Well, what we can do is we can actually control the circumference of your vessel. So nitroglycerin will dilate the vessel to allow more blood flow. So it's gonna, and I'll get into this in my next video that I'm gonna do. It's gonna be just all about the heart, and I'll really get down into this and kind of explain more. What it does is that it will increase this vessel, well actually all the vessels in your heart and everywhere else in your body pretty much, and it will allow for more blood flow. So that piece of embolism is gonna stay the same size, but it's gonna allow for more blood flow because of now the highways of your heart are getting bigger, allowing for more cars, aka blood, to go through. Okay? And that's how nitroglycerin works. It expands the vessels. Cool. So that is nitroglycerin for you guys in a nutshell right there. And I'm hungry. Should probably stop by like at Subway or something, huh? Get some food. That sounds good. Huh. I should get a penny for that. Just playing. Alright, so now glucose. Glucose, you swallow it, but why is it so important? That's what really matters. We need 3 things to survive, 3 basic elements, but really 2 are the main ones that matter. Glucose. Glucose matters. Glucose plus O2 equals ATP. ATP is life. ATP is what keeps you going. It's like the battery in your car for the body. That's what ATP is really. So if you don't have glucose, you can't make ATP, therefore you die. ATP keeps us going, it keeps life going, and I'll also get into that later on in a different video. But that's why glucose is so important though, because glucose is one of those basic elements that we need in our body to stay alive, to produce ATP. ATP is life. Adenosine triphosphate, look it up, Google it. Epinephrine. So how does epinephrine work? So remember I said that 4 things happen when you're going through anaphylactic shock. Well, one thing is that, I'll make some drawings for you guys. These right here are your lungs, right? This represents every vessel in your body right here. And then this represents your heart. Well, what happens is that your bronchioles are constricting, right? So they're going in. So you can't breathe that good. They're spasming. And your vessels are, the opposite's occurring with them. They're getting bigger, right? So blood pressure is gonna go down. And then your heart is just your heart, right? You want it to go faster. Well, what epinephrine does, it has 3 basic elements that helps you out. It has alpha properties, alpha 1, beta 1, and beta 2. Well, alpha 1, what this does is that it actually constricts the vessels, bringing your blood pressure up. So that's how that works. Now, beta 1 and beta 2, think of it this way. Beta 1, you have 1 heart. Beta 2, you have 2 lungs. So beta 1 actually increases your heart rate. It just stimulates it to go faster to get that blood pressure up also. And then beta 2 bronchodilate everything. So it's gonna dilate, it's gonna expand the bronchioles inside your lungs. And that's how that works. I might get into charcoal some other time because I actually have to go. Just got a phone call, that was my ringtone. And I hope you guys took some value. I know I kind of rushed through it. Sorry about that, but hey, it's free, right? You can't argue with free. So hit me up if you want anything else, if you want me to go into more detail about anything else. Peace.